Welcome, everybody. My name is Solome Tibabu. We're really excited about this topic today, and I see plenty of people are dialing in, so we'll give them just another moment. Okay, plenty of attendees dialing in to join us for our 2025 State of Behavioral Healthcare webinar in partnership with Kipu. Giving folks just a few more moments. Okay, I see plenty more are still dialing in, but we've got a ton to cover today. So for the sake of time, I would like to share a little bit about the agenda. I'm going to cover some housekeeping items. I'll introduce our panelists, and then we'll spend the bulk of the conversation live in discussion, but we will have an opportunity for Q&A from the audience at the end of the webinar. In order to participate in said Q&A, you can see at the bottom of your Zoom webinar screen, there's a little box called Q&A. Please feel free to drop your questions in this chat box, and our team will capture them throughout the webinar. And then at the end, I will go ahead and ask our panelists as many questions as we can get through. And then you will receive a recording of the webinar after we're complete with it, if you're here registered with us. Now, without further ado, I'm so excited to introduce our expert panelists. Let me go ahead and start with Karina, if you want to go ahead and introduce yourself first.
Hi, everybody. I'm Karina Edwards. I'm the CEO of Kipu Health. I am thrilled to be here today. 30-year health veteran. I joined Kipu a year and a half ago, and really thrilled to lead our organization as we deliver a behavioral health platform that helps organizations, their teams, and their patients thrive. So thrilled to share the results of our survey. Great participation, a lot to come today.
Wonderful. Now, Marco?
Hey guys, how are you? My name is Marco Merida. I really appreciate the opportunity to chat with you guys. Big fan of Kipu as always. For those of you who are not familiar, I'm the president of Guardian Recovery. We are a behavioral healthcare platform that has been in some pretty significant growth phase over the past 5 or 6 years. We focus on the adult substance use disorder space with now expansions into adolescent health, adolescent care. We do mental health. And really, we're a story about a company that's tried to stay small while we get big, and really looking forward to having the conversation in this space here today.
I love that. Stay small while growing. Which growth, technology, we have so much to cover. This survey that Kipu conducted is just very comprehensive, and we've got lots of topics. But before we dive in, I'd love to get a sense of who is in the audience with us. So we're going to go ahead and prop up a poll here. You can go ahead and select the choice that you would associate the size of your organization with. I'll give people a few moments. Okay, looks like we're getting quite a few responses. And now I've got a second question for our audience. What is your biggest challenge going into 2025? If you can pick just one, we just put up another poll here. I'll give folks a chance to read and vote. Okay, I'm seeing a few more responses. All right, 10 seconds to select your biggest challenge going into 2025, if you can choose just one. Awesome. Really appreciate that from our audience here. and we will go ahead and tailor our conversation based on these results. I can see we've got pressure from organizational growth was a top priority. Not surprising, keeping up with the latest tech, regulatory, of course, lots of regulatory changes happening. Well, panelists, we've got a lot to cover. So all amazing topics.
Stuff.
That's now just for another refresher for the audience. Today's discussion, Kipu Health had launched their survey by soliciting many behavioral health providers throughout the country. Respondents self-identified as those in leadership, clinical staff, non-clinical staff. So they got tons of perspectives, and they were able to compile those results in this amazing State of Behavioral Health 2025 Outlook. And so that's what we're discussing today. So I'm gonna start high level, and then I'll go dive deeper with each of you. But to get started, perhaps Karina, I'll start with you. Can you talk a little bit about what have been the biggest takeaways from the study, and what insights would you say, if you had to, at the highest level, could you provide the behavioral health community here?
Yeah, no, thank you for that. So the report summarized our findings from over 1,000 responses, and I think that was great. They are not all Kipu customers. We went really broad. So just to give us all of that view from leaders, clinical staff, non-clinical staff, as you stated. And so when I think about the 5 themes that really came out, and not surprising, we just saw them in the poll: staffing shortages, team burnout, administrative burdens, right? You all are facing staffing shortages and pressures. We looked at the survey, and 38% of leaders find it difficult to retain staff. And we're going to talk about some strategies there on like how to assess and retain the teams that you do have. And then also, how can we streamline workflows and administrative tasks to free up the care teams so they can focus on care and yet still provide regulatory compliance and all the things you have to document. So a lot of topics there. The second, I would say that the fourth, right? So staffing shortages, team burnout, administrative burdens. Let's hit financial health, right? Big payer pressures happening across the board, not surprising. Value-based contracts, not really a reality in this space quite yet. So a lot came out in the report there. And then last is the role that technology can play. 84% of leaders believe it can help. And yet now the question is, in which ways? Administrative support, clinical support, where does AI come in? So lots to unpack here in the way that we'll analyze the outputs, but those are the big themes, and very, very meaty and very relevant to the audience at hand.
Yeah, that's a lot that I want to ask each of you about, every single one of them. And in fact, starting with that first one, I mean, that's just astounding. 38% of leaders, I believe you said, finding it a difficult time to retain staff. So perhaps, Marco, I'll ask you the first question around workforce challenges and burnout. Talk a little bit about what that looks like at Guardian.
Sure. We're an interesting study because we not 6 years ago we were in one state and 2-3 facilities, and today we're standing at across 7 states, 21 facilities. So we've gone through this kind of explosive growth. And we've leaned into sort of 2 solutions for us. Part of it has really been around culture and leaning into a mission and purpose-driven organization, which we have found as a natural part of our DNA. And that's, if you have that opportunity to lean into that, it's a way to really crystallize that loyalty that can live inside of an organization that's truly purpose-driven. But the other side of it is leveraging technology and figuring out ways to eliminate some of the brain damage that happens in daily work and daily tasks, and being a little more strategic around where and how you implement that to take away some of that burden, so that people enjoy, purpose-driven, they enjoy coming to work, and then while they're in work, they get satisfaction out of it. So that tends to be a reality for us in our world at Guardian. We've been very lucky with turnover rate of around 10%. It kind of peaks and valleys in a couple spot areas, but leaning into technology and leaning into culture are big answers for us. I don't know, how it is for some of the other players, but that's kind of our world.
Yeah, no, I can share like, broader player perspective. When I think about our customers and the customers that I talk to beyond you guys, and I think the themes are consistent. That notion culture trumps strategy. It really is a truth here. So how to figure out your empathy levels, how to think about that therapeutic alliance being created with patient care, and then taking that back up and saying organizationally, how are we investing in our frontline staff? How are we growing our frontline staff? How are we accrediting our frontline staff? How are we keeping them compliant? So all of that kind of rolls back together. But if kind of done in void of culture, small company, big growth, there's that balance. Because as you scale, processes are required. You have to be able to have the risk assessments done, and that's a hard balance. And so it's not easy to do in a workforce that is also wildly mission driven. So many of the frontline staff here got into this business to truly, change and have patients thrive. And so I think respecting that and embracing that critical across the board.
And I would take that one step further and also to some degree getting out of their way. Like, let leaders lead is a theme for Guardian in 2025. And part of that is the administration and the back office's responsibility to clear the path for them to do what's best for the client. Because if you can truly generate a client-centric philosophy where processes support that, where the employees live and breathe that, you really do end up getting a better output for the clients, a better environment for the employees, and I think the payers respect that as well. So I think there's a way to balance to score a win-win-win there.
Really great points. And I found that there appears to be a disconnect between leadership perceptions and staff realities, particularly when it comes around burnout. Any strategies you found that could be useful in bridging that gap?
I can take the first shot at that. So for us, we lean into the exit surveys. We listen to those. It's unfortunate when you're catching that content at the end of the possibility to solve, but it's still an opportunity to course correct. We also, outside of the exit surveys, we do employee surveys throughout the year, not frequently, but at least I think we have 2 touch points. And some of it is around work-life balance. Some of it is around just organizational support. And we will, we prioritize, we always think of things in kind of a 2x2 matrix where it's like low level of effort and high level of output. And in that top quadrant where we can identify opportunities that make the environment better for the client, provide a better atmosphere for the employees, and drive value for the customer. If you can find those in a way that doesn't initially generate a lot of drag or damage to the organization, those are no-brainers. And then there's sort of that middle swath where you're making strategic decisions to make adjustments because there's an understanding and a trade-off between that balance of retaining good talent and then turnover and retraining, whatever. So it's really making sure that you have a finger on the pulse of what's going on inside of your organization, one, but two is making a strategic and economic commitment to make decisive moves to move the organization where it's material and meaningful and sticking with that.
Love that. And Karina, you started talking a little bit about how critical culture is within an organization. Could you offer a few examples of how you could bring that to life? We live in a remote world these days. Like, what are some ways providers can implement some of these tactics?
I think, Marco touched on a few of them, some best practices that we see implemented a lot, right? It's don't be afraid to ask. Ask early and often. And I think they respect that, but don't ask with deaf ears, right? Listen, hear, assess. What can you do differently? How can you change the workflow? Share with them the challenge that you're facing as a business. I feel so many times if people don't understand context, if they don't understand where the organization is going and why this is a pinch point right now, but relief is coming as we continue to scale, they can see you through and they can brainstorm opportunities with you. Here's how you can make my life better. Oh, by the way, I'm a therapist and I can't run 4 groups in one day, because do you know that means I got 40 pieces of documentation I got to do if my groups are 10, 10 patients. I need some time. It's the sharing up and down, I think, that's critical. I think also use your partners, right? And so I think we always ask our customer base to use us. We have a Kipu Academy, we have the ability to train your staff, we have the ability to make sure the UI, UX and the workflow is working in a way that's optimal for your business and your state. So those are the things, like, know that you have partners in this that can help you.
And I'd also say much of what you suggest applies to visibility into career paths for a lot of clinicians.
100%.
That came up a bit more in the survey as well.
Yeah, 100%. I think that's where, like, if you think about that career pathing piece, everybody wants to feel invested in, right? We all want to grow. If you're not growing, so the saying, you're not growing, you're dying. So I think everyone just wants to lean in it and do more.
All important points, because I mean, something like a quarter of staff are looking for new roles at any given time. Just astounding. So excellent strategies here, and I'll be asking you a little bit more about that throughout. But of course, we at Behavioral Health Tech are very excited about technology. So not for tech's sake, but particularly how is it improving the lives of staff, outcomes for providers. And so, Karina, maybe I can start with you as well on this one.
Yeah, you look at the data, right? So back to the data. Leaders and clinicians absolutely believe technology can help. We actually think about this more from a workflow perspective of the organization, but then in the delivery of patient care, right? We've come so far with technology tools. Marco can talk about telehealth. We can talk about how we're running these sessions, how we're capturing these sessions. We're going to move into AI. But when you think about my biggest takeaway from so much of this, yes, it can help, but technology alone is not the answer. And I think you said it, Salome. Tech for tech's sake doesn't make sense. First and foremost, do you know your process? People, process, technology, right? First, we talked about culture. Have you hired the right people? Now, do you know your process? Have you documented your process? Do you understand your processes? Do you understand your key performance indicators of the things that you should be measuring as telemetry for success? And now you can implement technology underneath that. It's organizations that get into trouble that, like, throw all this technology at it, and then now they can't make heads or tails of, like, well, hold on, this vendor says this, and then now it doesn't really connect with this vendor, and they haven't thought through that end-to-end workflow of, if I'm an executive, here's my dashboard. If I'm a clinical leader, here's my dashboard. If I'm an ops leader, here's my dashboard. And here's how I'm maintaining compliance. So I think throughout the wheel of acquisition, how do you reach patients? How are they coming in? What are your referral sources? Follow that through. Okay. How do you, now you have them? How do you treat them? How do you make sure documentation is compliant? How do you bill for the care that you actually delivered? How is that clean? What's the patient's involvement in that? Their family's involvement in that? And then all through this whole circle, right? How do you then engage alumni and bring them back and have a robust network of those insights to truly then thrive as you're scaling here? So I know technology can help. We'll talk about AI next, but Marco, I think you guys have done a great job on that, like, end to end. So want to say a little bit more about just your technology vision.
Sure. For us, technology is an enabler, and it's a key differentiator there. It is not a strategy, it's an enabler. It has to be there to empower strategy. So first and foremost, you have to have a clear vision and purpose of what you're trying to accomplish. And that's not just organizationally for the company, but it's also housed within functional areas. And then there's sort of two tactics and approaches. One is where you can drive exceptional value, and then others is where can you, I always go back to the brain damage, but where can you eliminate brain damage in the organization? And then the underlying metric of that is metrics, and how do you measure? So for us, it really was taking a holistic view, starting with the client and the client journey, and then understanding all of the touch points that we had available to us, or needed to have available to us in order to measure what a good client experience was. And if you think of that in terms of a funnel, working from the top of the funnel, from the first points of contact all the way through their process of coming into and being part of our care. And then you've touched on it, which is, documenting throughout that care, holding ourselves accountable to what great care is. And then on the back end, trying to identify and understand what are the best indicators of successful outcomes. And that for us was those were the lean in points for technology. For us, it really was integrating our our telephony system to our EMR, to our CRM system, to our back end billing and collection system, to then tying that all back into our internal audits of taking the pay, and I don't want to jump ahead, but touching on the payer standards that are required to ensure that we are doing the best that we can to hold ourselves accountable towards enforcing the client journey and ensuring authorizations all the way through outcomes, and then layering those pieces of technology all connected. And then the last piece of that is, and I would encourage, pilot first, right? Don't go and implement massive swath changes in and throughout the entire organization, but pilot it in a smaller, safer environment, so that as you look at what that spill out repercussion is going to be to people, process, technology, the workflows, you can then course correct and adjust before you roll it out. I think that's a better approach to leveraging technology without technology becoming a disruptor, which is what can happen if implemented either improperly or poorly.
What a great journey you've highlighted, Marco. Of course, I can imagine with all of that, there had to be some change management practices. What advice do you have in regards to that for the providers in the audience here?
Yeah, so my background is in strategy consulting, and I had sort of a subspecialty in change management, because back in my old days in consulting, we realized that change management, if ignored, could take a perfectly good idea or implementation and implode it. And so part of that is recognizing that emotional cycle of change, where individuals come in and they're excited, then they get a little wary, then they're in that pit of despair, then they start to see the light at the end of the tunnel, and okay, great, we've come to something better. The key around change management for me is two things. One is involving the stakeholders early and often, and two is over communicating. So to the extent that you can identify the right stakeholders that are the linchpins to the change that you're trying to infuse in the organization, and then two, having two-way dialogue and open and honest conversation, so that you can properly react to the feedback and the realities of where the rubber meets the road, then you have a better chance of managing through that change. Because in absence of that, you'll have something that's just shoved down from the top, and it just will not. The key is to get this to a point where it is part of your DNA, and the only way that can happen is top down and bottom up.
Excellent advice, and really important, because now is the time, now is the moment that tech can really make a difference in the lives of patients, providers, payers. And I think I even saw.
And I'll jump one last point there. The other piece of that is find a technology partner or a strategic partner that is a partner, right? Someone who listens and understands and reacts and guides, right? Because I'd love to think that I have all the best ideas when it comes to technology, but if you're not leaning into the subject matter expertise of your technology partners as trusted advisors in the process, you miss out something there as well.
Could make the world of difference. Absolutely. Karina, you brought up AI. Of course, we can't talk about tech and not AI. Would love for you to share a bit more about what you saw in terms of adoption, how it's working.
Yeah, what I loved about the results here, right? There's an AI who, when, where, what, and why, right? So I think there's just the first is, yeah, we're currently using it to 17% early adopters, great. See that normal distribution. 35% thinking about using it, considering using it. I don't know if I want to use it, not even going to go near it. And my perspective here is, at Kipu, we took a very deep, long pause as AI was coming out, and we said, we got to get this right. Right. When we were at 1,400 customers, 4,000 facilities, and we could not put something out there that was not deep in ethical standards, truly tried and tested and scaled. And when we thought about where we could add the most help, we partnered with some of the best in the industry. AWS was our strategic partner here. And so what we did was we actually did something for the clinicians. We said, okay, what's a huge pain point? Documentation is always hard. I'm about to go in and see a patient. Like, what's the fastest thing I can do? Let me save them about 15 minutes of reviewing a chart by giving them a quick chart snapshot. Let me give something back to them before we have to because they're already burdened. And so we started with a quick chart snapshot. Then we started with a transcription and a structured note, and thinking about how that note was then facilitated, but not carbon copied. I spent years at Nuance in the clinical documentation space and the clinical voice space for natural language processing. What happened quickly at the acute care side of the house, we did not want to replicate. We lost the patient story in the automated notes. So now, how do you keep the patient story alive and well in the automated notes? And how do you make sure that there is sign off and true compliance? Because now I can do a real-time compliance check right on that document. So when we thought about this, those are the first two areas we tackled. Next, of course, we all want to solve the groups issue, right? Groups on telehealth, very easy to solve. Groups in person, very different to solve. Many clinicians out there might be having this debate of in behavioral health, if the patient knows they're being recorded, are they changing? Are they acting differently? What's that going to do to the therapeutic alliance? People don't want to run into this. They want to be thoughtful about it to make sure that the outcome is the best for the patient. So now where we're really focusing is on the administrative burden stuff, right? What else can we do for the chief compliance officer? What can we do for the chief administrative officer? How can we make their worlds more insightful and less about that one-to-one patient care? So that was our AI roadmap. Back to the ethics piece is important. So we have a real-time feedback loop. We never want to get it wrong. So every single chart summary, every single transcription, it's simple. There's a thumbs up, thumbs down. Is this working? Was this right? Did you like this? So we are continuously learning at scale together with the best prompt engineers in the business. And so my point to all of the audience is saying, AI is not AI is not AI. They're not all created equal. Who is the underlying data set? Where is that information coming from? How is it being vetted? Is it a diverse set of inputs? Is it the right the right scale for what you're trying to accomplish? Because you can't get it wrong because it's patient care. So clearly passionate about this, love it. But Marco, you were an early adopter here, so
Yeah.
yeah.
It's funny. So we were a few years early on this, and I was, I could have avoided a lot of brain damage if this had been pushed out like 4 years ago. But 4 years ago, we saw a need inside of our organization to create some kind of clinical compliance and audit tool. And so, I have a little bit of a techie background. So I wrote an algorithm internally here that basically measured our compliance to payer standards on a qualitative and quantitative measure, blah, blah, blah. It's super cool. And it worked for us for many years, but it was manual, and it was kind of that expression, in absence of bread, tortilla will do. We were hoping and waiting for somebody bigger, smarter, and better to come in. And that's where this solution comes in. There's 3 areas in our organization where we are targeting AI solutions as pilots for this year in particular. The no-brainer, easy, low-risk environment is going to be around your CRM and your marketing and marketing automation. And there's definite, there's less risky stuff you can do there because there's no client exposure necessarily directly where you have potential concerns. The second area obviously is around this, the clinical notes and clinical compliance, which I am the most excited about, and figuring out how to navigate that, the concerns that clinicians might have that you touched on, and payers might have and what those look like. And then the third area for us is in revenue cycle management, and there's some opportunities in there. So those are the three agent-driven AI solutions that we're targeting. But as it relates to the compliance piece, I think for me, at a minimum, if they're, when you are ready to take on the ability to audit yourselves through AI with the compliance against payers, that's a check mark. You got to do that. And then if you can take it a step further and have it eliminate some of the administrative burden where a 45-minute job is now dropped down to 30 minutes or 20 minutes, what you're doing and the value there is you are freeing up time for that clinician to provide direct care back to the client, which at the end of the day is a win for the payers, it's a win for the client, and it's a win for your company. So again, that we look at it as ways to eliminate administrative work that allows us to refocus that time and energy back on the client experience, and that's a win for us all day long.
Yes, it again goes to show that tech is not optional. It's critical to growth, which maybe we'll pivot into that topic. Would love to hear from both of you some of the results in regards to strategic growth and integrated care models as well. Perhaps, Marco, if I could start with you, how are you thinking about growth at Guardian?
For us, it really is around we're proponents of the Rockefeller habits, which ultimately is a vertical and horizontal integration. The point of that is that if you start with a client-centric model first and you build your business around identifying and solving for things that drive for a better client journey, and if you believe and hold yourself accountable to delivering what you think is the best product, then you have an obligation to extend that reach as far as possible into that healthcare process. So for us, the natural extension of that is a variety of things. It's a broader expansion to in-network so that we can cast as wide a net as possible to help as many individuals as possible. It's to broaden the sectors with which we focus. So as opposed to being a singularly focused substance use disorder vertical for adults, we've now expanded into adolescents. We've gone into mental care. We've also started looking at medication management. The point of this is figuring out ways to be relevant solutions to the client at multiple touch points in their healthcare journey and being able to add value in those points. And what it does is it gives us a clearer picture of their healthcare journey. The win for the payers is as we extend our care beyond, we do inpatient, we do intensive outpatient. We've now moved to outpatient. We've gone through the virtual route. We're also exploring in-home health care. Those are natural extensions. And so that really has driven our strategy of growth, which has been partially geographic with a hub and spoke model, but more importantly, from a service line, it's identifying ways to meaningfully impact the client's behavioral health care journey and providing opportunities to not only be valuable and be of assistance, but also be there to identify trends. And that gets back to that data component and the technology component. And another place where AI will hopefully and potentially be, a consideration is where does AI, AI does a much better job of identifying trends than we could. So are there trends that it can start to identify that might allow for the indication of triggers that might be, hey, here's an issue that has an increasing probability of occurring. What can we do to intervene in that process? And how can we be good stewards of those clients? And having that wide behavioral healthcare exposure allows us to service in that regard.
Great examples, Marco. And Karina, what are you seeing across clients?
Yeah, across our customers, a lot of similar trends, especially in our top scale 25%, right? We see this push back to whole person care and just everything you're talking about. And when I think about that in particular, one of the things I always remind customers of, first, moving from substance use disorder, all levels of care from residential all the way through outpatient or even outpatient standalone and now MAT, those are different clinical workflows, right? You know that. And then you add on mental health, different clinical workflow. You add on any kind of primary care kind of coming into your facilities, think of different workflow. You want to make sure, back to the people, process, and technologies, it's not just about, don't assume the configuration you have today will support your scale. And so I think, Marco and I joined a year and a half ago. He was one of the first customers I met. And I said, so as we've been scaling, how have we been doing it? It's like, you know what? We haven't revisited what was implemented in that workflow. We should do that now. We're now scaling into multiple states. We're doing different service lines. We're looking at different health components. How do we optimize that? So my message to everybody is, what got you here won't get you there. And that's just a common theme. So use your partners. Whether we're your solution, you have a different solution, but just say, hey, let them know where you're going. Like, if my team's not asking you, what's your growth strategy? Where are your growth goals? How do we help you get there? What are the things that you and your leadership team are at offsites talking about for 2025 and 26? What horizons do we need to be aware of? That's that partnership and alliance that we have to forge to make sure that we're supporting you at scale.
Excellent advice. Now, in fact, I'm going to bounce around a little bit. You mentioned partnership and alliances. Of course, provider-payer partnerships are a big one. I know that was a major theme in the survey. So perhaps we can talk a little bit about that. Karina, maybe I'll start with you again. Can you talk a little bit about some of the shift in payer dynamics recently and how facilities have been adapting?
Well, I can't speak to the last 3 days, so we know things are fast evolving. So we'll see where that goes. What I can speak to right now is, over 2024, we saw, especially on the Medicaid and out of network, a lot of compression on reimbursement rates, right? I think that's growing across the board. I think with that, though, comes this need for reporting and that balance. Because if you don't think that the payers are using AI on all of your submissions, right, there's going to be a little bit of an arms race here to make sure that you are getting reimbursed for the care provided, and you have the defensibility to say, hey, I'm looking at like my patients in all of my cohorts, and I'm looking at what you've reimbursed historically and on what I have today, and I'm noticing there's a gap in 6 or 7 of these that should have been at this level of care. What changed? So being able to arm you with that information. I also think there are some, in some sectors of the market, eating disorder in particular, value-based contracts are becoming a more real thing, a little bit more akin to acute care, a little bit more like just a little bit more physical health. So that's one of those areas that we're watching closely on how do we support value-based care reimbursements and contracts, and looking at that differently from your margin perspective and you as operators to drive the best outcome for the population that you're serving. So that's what we're seeing in the payer provider partnership. But Marco, you're on the front.
It's I would say that 4 or 5 years ago, it was a much more like, I'm not going to say adversarial relationship, but it was definitely more of an us versus them. And part of the change in how we've approached it is really trying to figure out how to sit at the table with payers and understand what are their pain points, and then modify not only our processes to help serve those pain points, readmissions, emergency care visit, all those types of things that are costly drivers for them. But also figure out what metrics that we need to track and demonstrate in order to at least make the case for, hey, we are trying to be one of the good guys in the space, help provide clarity for us. One of the tactics that we've employed, which is a little more difficult, I think, when you're in that, organizations are in 2 phases of their growth. They're on the front end where they're highly focused on cash flow, and those dollars, matter on the day to day. And then there's a point where that balance shifts to enterprise value. And in that shift, somewhere in that shift, there's that opportunity to try to drive additional value through the value-based contract relationships. And so not having clear insights from the payers is difficult, but one of our tactics has been, we've taken, and this is that sort of finding that moment, was we took the highest standard provided and made that our lowest bar for entry. So what that does is, payer one might require, an order winner to be here. Payer two might be here. We drop that requirement and we move to the higher bar. It does two things. One, it elevates the level of service for the clients. And number two, it standardizes what you're measuring your team towards. The flip side of that is it will be more costly. So there's that, in that cycle between cash flow and enterprise value, you have to find the right moment to insert that strategy and tactic, or at least where you can move those needles. And then one of the byproducts is that when payers see that you are setting standards higher than what their standards might be in certain instances, it opens the dialogue for those value-based conversations. And then the key is landing on metrics that are measurable and are like movable, like things that you can actually impact. And then moving the organization in a partnership fashion with the payers. But you're right. For SUD in particular, we're on the bleeding front edge of that thing. There's no clear insight as to what those criteria are going to be. Personally, I want to be a seat and a voice at the table that helps set those standards. So that's been our strategy, but it'll be a few more years before we see it as a standard. But we're open to it. We're excited for it.
Excellent. Great points. And for our attendees, just a reminder, we do have that Q&A box. So this is your last opportunity to submit any questions. And we've also announced in the chat there that you can download the full Kipu Behavioral Health Survey report in that link. But that being said, still quite a few topics I'm hoping to ask you both about. I know RCM came up a few times in our conversation already. Would love to hear about everything from setup, as you were just saying, Marco, to ongoing maintenance, how RCM is so fundamental to growth. Karina, you want to go first on this one?
Sure, happy to. I think, first and foremost, given the range of customers that we have, just that I'm familiar with, it really comes down to what's right for you right now. So first things first, are you doing in-house or are you doing third party? That in itself is a critical decision, because now you're really saying, right, how am I thinking about my revenue reimbursement? How am I thinking about all of the data needs I have, either to a third party acting on my behalf or in-house? How am I running that? And then do your systems then support that? I think one of the things that people don't know a lot about, and especially some of our smaller customers, and this is just that mission-driven organization that's just getting started, just kind of coming out of the gate, there is this notion of no money, no mission. And I hate to be that blunt, but if we can't keep our doors open, we can't care for patients. And if we can't defend the level of care through reimbursement and documentation and systems, and get that documentation through and all the claims rates and maximize, as well as collections, right? Where is the patient responsibility in this? If they're on a commercial and network contract, your payers are going to start asking that question, are you trying to collect? Right. And so that proof, again, it's that, where is that reporting? So, I know it's harsh sometimes to just talk about the revenue cycle side of the business, but it's really important to drive. So I think that's one thing I'm seeing holistically. I think the other thing is, right, your mix is going to be important, especially on your CRM and patient acquisition. All of this is not done in isolation. And so when you think about your healthiest client base, and like, not from the outcomes perspective, but two, who is most successful in your care, and three, how are you getting reimbursed? That then needs to jump to the front end to say, how am I attracting and acquiring and retaining that patient population in my services and my care? So I think it's full circle, but Marco, back to, you live this day in, day out.
Yeah, I mean, briefly, because I know we're getting close on time, but for us, there's two lenses that we look at it. One, it is the canary in the mine shaft, right? It's the first indicator of a problem. And so to your point, it is the validation for the work that we do. And you should be getting paid for that. And if there's a problem with that, RCM is going to be the first indicator to go, hey, there's an issue here. So that's where it lives, on that first half of your life cycle around cash flows, and that's important. It's also a strategic component to the company, right? It is a way to understand your ROI, and understand where to invest and deploy assets where you're getting the best yield. And in the middle of that process, it is the indicator of health with your ability to be good stewards of the client journey. And but what I mean by that is authorizations. And so if the documentation isn't there, if the compliance isn't there, all of that's going to become a big glowing red light in RCM. So for us, RCM is a critical strategic component to the organization, and also sort of that first indicator of what's going on, what's going wrong.
Excellent. Thank you. Thank you both so much. Now, as I mentioned, I have so many questions I want to ask, but just to wrap up and ensure our audience can get an opportunity to ask questions, I would love to know if you could pick one piece of advice for the behavioral health community for 2025, what would that be? And Marco, if you want to go ahead first.
Sorry, say that again because my audio cut out real quick.
Yeah, if you could just choose one piece of advice for the behavioral health community for 2025, what would it be?
For me, it's the client-centric approach. Start and end every conversation with what is best for the client, and then build your processes, your strategies, your technology, all of that in service of that, and the business will follow. And it sounds like pithy advice, but we have done very well with leading with client first and thinking about and understanding what is relevant in the client journey. And when you lead with that, we have found that it will 99 out of 100 times drive for the best business environment. And as a part of that, it's, invest in your staff, leverage technology as an enabler. And I think that would be it for us.
Karina?
Yeah, so my advice here, I always love to just say it's people first, right? And so, the way I look at that is culture comes first, process comes second, technology comes third. And keep that in mind in everything. And then the other thing I think I'm just going to build off, we have 3 core values at Kipu. And first is customers at the center of everything we do. And I know Marco, clients, the center of everything we do, right? It's in the DNA. And so always ask yourself, if you're ever struggling with something, one of the things we do in meetings, we either bring our customers into meetings internally and say, hey, how would you solve this problem collectively? Or 2, we actually ask ourselves, like, if this empty chair in this room was our customer, how would they react to this conversation? And it's a great gut check on, like, am I living my cultural values and norms? So those are the 2 pieces of advice for 25, because I do think that notion of really wrapping whole person care and client-centered care is critical with everything.
Just wonderful results through and responses for the survey, the webinar. Thank you both so much. Now, I'm going to pivot to Q&A. So I see a few are rolling in here. First question, it looks like might be a Karina question. We've got, hello, Karina and Marco. Love the discussion. Kipu has been partnering with, acquiring vendors, other vendors, Elios, Hatch. What does 2025 look like for integration of these programs with the EMR? So
yeah, no, great question. Yeah, so for the broader audience, right? So we have a marketplace of third-party partners. Elios is one of them. They plug in to our browser. They are a partner that you can leverage. From an AI perspective, we have now our own AI that we are offering. It's called KIP, the Kipu Intelligence Platform. That was the chart summary. That was the transcription inside of the EMR. It's a lovely little magical button you can click, and now the clinicians can leverage it. So if you don't know about that, please ask us. We have that at the ready for you. We did bring the Hatch team into the Kipu family in July. With that, not only do we have a standalone learning management system and compliance system that you can leverage, but the beautiful piece is, back to your question, the 3,000 rules that we acquired with that, the true compliance rules. They are now, I'm not allowed to say when it's going to be released, but I have a proof of concept where AWS and us worked together. We took those rules. We took documents, not just from a Kipu EMR, but from every, different type of clinical document. We ran them through and got a compliance score. So that's kind of a preview of what's to come real time in documentation, so we can actually think about how we can coach and mentor our staff as they're doing their documentation to align at the front end of the process, not the back end of the process when they have to resubmit.
Awesome. And congratulations. Super exciting.
It's been great.
Let's see here. Next question. For organizations looking to optimize staffing and expand access to care, what qualities or capabilities do you think make an external hiring party truly valuable? Marco, any experience with external
Sure.
party?
Yeah, we've gone through a couple different iterations of the solution. We experimented with external providers. We've actually brought the function in-house. We created our own staffing company, mostly because we wanted to control the outcomes a little better. But what I would say is what I was looking for with external staffing providers is, one, specific industry knowledge and expertise. If I was explaining to them what we were doing inside of the space, they were the wrong partner for us. Once they sort of clear that first hurdle of industry knowledge, the second one for me is total number of placements in the functional area that we were looking to staff for. So is it nursing? Is it tech? Whatever those functional areas, I want stats of number of successful placements for by functional area. And then I also want to understand for the, and I'm not taking cost into consideration, it's just performance. And then the last piece is duration of those individuals post-hire. So what's their fall off rate or their rate of attrition at 30 days, at 6 months, at 1 year and beyond, and do they have those stats? If they're hitting those criteria, okay, that's sort of the order qualifier for us. The order winner is fit for our culture, and part of that is really making sure that you have, your HR individual has to have like the finger on the pulse with that organization to course correct. So providing feedback as to why something did or did not work is super clutch. And if you're having difficulty for that, and you've scaled big enough and you can bring it in-house, that's another solution.
Excellent advice. Thanks. Let's see. We covered a little of this throughout our session here, but if either of you can double down, how should providers think about compliance with all of the regulation and tech changes?
I think one, I'll jump in really quickly here because clearly we acquired a solution in this space. The eye-opening piece for me is people that don't have a technology solution to support compliance. One, I would say assess your as is state. Are you living in binders on shelves? Are you living in paper world? Like, how can we help you with this? And do you know all your rules? Do you have a source of truth for all of the rules? Happy to help anyone out there on that space to make sure we can even assess just where you are today. Whether you choose our solution or somebody else's, great, but at least give you a baseline of where you're coming from.
I couldn't agree more. You need a technology solution, if for nothing else, to, if you are genuinely focused on the client, you have to hold yourself accountable to that client journey. And one of the ways to do that is to measure your compliance against the standards that the payers put out in front of you, because that is a measure of success within the organization. It ties back to RCM. And so that you can't do that manually, not at scale. And you need a technology partner that can get you there. And you need the mechanisms internally to course correct and adjust, for each of your facilities, for each of your service lines, for every level of care, whatever that construct is, where you're taking individualized metrics and measures where there is some, instability in what you're providing, and then provide corrective measures and corrective courses of action. So it's not just about measuring and getting a report card and a scorecard, but it's also understanding what are the corrective measures that you can employ in the near term and the long term, and then checking the efficacy of those to see those scores improving. Otherwise, you don't really know if you're impacting the journey the way that you want.
Thank you both. For the audience, we've got a few more links for you in the chat here. Please feel free to copy and paste that as we shut down the webinar here. They'll disappear. So the first one if you'd like to schedule a consultation with Kipu for some more tailored guidance. Of course, we had a robust conversation and could only touch on so many topics that we could in the hour here. Please feel free to book some time with their team. You can also have an opportunity to continue learning more and absorbing the many resources and events that they've developed. So that's our second link here. And just to ensure that we can stick to our schedule here, I might just wrap up and ask each of you, where else can folks find out more information about your organization? Marco, perhaps you first.
Yeah, for us, you can just go to guardianrecovery.com. That's our website, and we'll give you an insight into what we do and what our purpose is and how we might be of assistance. And really just super grateful and thankful to be part of this process. Appreciate it as always, and look forward to hearing more developments out of everyone.
Thank you so
Awesome.
much. Yeah, I think it's for Kipu, it's kipuhealth.com. And also, yeah, feel free, reach out to me. I'm happy to always field customer contacts, and I'll even, not even afraid, karina.edwards@kipuhealth.com. So bring it here. We love to engage with our customers. We love to think about and talk about where the industry is going. If we, for any reason, have not been a partner at the level that you'd like us to be, we are all ears and we are all in. So please, reach out, and thank you so much for the time. Salome, thank you so much for the platform, and Marco, thank you so much for the partnership. So great session, everybody.
Likewise. And thanks everyone for attending. Again, I'm Salome Tibabu, host of Behavioral Health Tech. If you enjoyed this conversation, ensure you're on our newsletter for upcoming events. And finally, thank you, Karina, Marco, for the amazing conversation and rapid fire questions. Excited for our audience to read the survey and the survey results, and looking forward to our next event together. Thank you,
Awesome.
everyone.
Thanks, everyone. Bye.